Good morning and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, June 23rd, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good morning and thank you, Brad. More than 3 million doses, including almost 40,000 in the last day alone, have now been administered by our Team Toronto vaccination effort, and this is a wonderful performance, good solid progress so far. This means that more than 75% of adults who've received a first dose and more than 30% of adults who've received a second dose are therefore fully vaccinated, the 30%. But I also want to put it in even clearer terms. More than 2.18 million people have received at least one dose of vaccine from Team Toronto, and more than 820,000 people have been fully vaccinated in the City of Toronto. This is great progress, and I want to be clear why. Every resident who gets their first and second doses of COVID-19 vaccine will ensure that they have protection from the virus and from the Delta variant. A huge thank you to all of Team Toronto, a really exemplary performance so far that we can be really proud of, albeit with much to be done. This helps protect our progress fighting COVID-19 and ultimately ensures that we can continue to proceed with the provincial reopening, which I'm eager to see happen safely and as soon as possible. We all want to reopen, but we all want to make sure that we don't end up having to go backwards and shut anything down again. We continue to add appointment bookings for Toronto Vaccine Day coming up this Sunday at the Scotiabank Arena. So far, more than 21,720 people have now registered for that event at the Scotiabank Arena on Sunday. We now hope to have capacity for at least 25,000 appointments. This is our winning shot, and I want to say a big thank you to everyone who's already stepped forward to be a part of this record-breaking vaccination effort. And we're doing everything we can with all of our partners to make sure this day is a success. And I should extend thanks again to our partners who are in this, some of the hospitals, Maple Leaf Sports and Entertainment, and a number of others who are helping us to make this day a big success. I'm proud to announce today that to support the Toronto Vaccine Day initiative, the TTC will be providing free rides this Sunday to and from booked appointments at Scotiabank and any vaccination clinic within the City of Toronto. So it includes the one at Scotiabank Arena, but also includes all of the other vaccination clinics in the City of Toronto, free rides to and from on the TTC. Customers taking transit will be asked to show proof of booking of their appointment when riding the TTC to the clinic. The confirmation of their shot will be their return ticket home from the clinic. As well, the TTC is extending this offer to anyone working or volunteering at one of the vaccine clinics on Sunday. All those workers need to do is show employee ID for their free rides. I want to thank TTC CEO Rick Leary and the 16,000 men and women of the TTC for supporting this program and for being there for the city throughout the pandemic, day in and day out. Metrolinx is also joining the vaccination efforts by offering free travel to Union Station and the Scotiabank Arena vaccine clinic and back home again on Go and Up Express for anyone with confirmation of a vaccine appointment. This offer is also being extended to staff and volunteers supporting the Scotiabank Clinic with appropriate ID. Also, Torontonians can get further information about Toronto Vaccine Day and the clinic at Scotiabank Arena from the VaxTO text line by texting the word SHOT to 1-833-750-0888. The TO Supports Targeted Equity Action Plan has been a guiding principle in the rollout of our COVID-19 vaccination program. To ensure no one is left behind when it comes to vaccine access, we've worked with marginalized and racialized communities right across the city. We established the Black Scientist Task Force on Vaccine Equity. We allocated funding for community vaccine engagement teams and vaccine ambassadors, a transportation equity plan for seniors and vulnerable residents to give them free rides to vaccine clinics, an accessibility task force on COVID-19 vaccines to support people with disabilities. These are all measures that we have put in place through this equity program and as well as measures to help focus on young people and helping them to get vaccinated as well. Today we're launching another aspect of that in that we have put together the Toronto Youth Vaccine Engagement Strategy, a partnership between the City and the Toronto Youth Cabinet to support vulnerable youth in communities most impacted by COVID-19 to access a vaccination. We've made good progress when it comes to people aged 12 to 17 getting vaccinated. More than 60% of these young people have had their first dose. But we also know there are isolated young people from all backgrounds spread across the city, and they're isolated. These young people, like the rest of us, tend to listen and to engage with people that they know and that they trust. So our diverse group of youth-led partners will be leveraging existing channels and programs to reach out to them to help drive up vaccination rates even higher among young people generally, but also among these more marginalized, isolated young people. The Youth Cabinet's newly formed Toronto Youth Vaccination Advisory Committee will work with the City to encourage and enable vaccine uptake among youth. I congratulate Samir John Mohammed and Nadi Dali, who have taken on the role of advisory co-chairs, and I thank them, as well as their fellow advisory members and all the groups who play an active role in engaging vulnerable youth in our city to protect their health through increased vaccine uptake. It has been a Team Toronto effort all the way when it comes to vaccination, and this is one more way we're expanding the team to make sure everyone, every single eligible age and in every single part of our city gets vaccinated, because we know how much good that is going to do in terms of preserving and protecting the health of the city, but also leading us on the pathway back to a more normal life as soon as possible. I'd now like to invite Dr. de Villa to offer her remarks for today.
Thank you, Mayor Tory, and good morning. Because we're coming to you a little earlier than usual, today's numbers will be updated and found on our dashboard later this afternoon. Overall, though, the numbers show that we have come a long way in a short period of time because so many of you have done the wise thing and protected yourself through vaccination. There's a lot of change and new information in constant circulation about the vaccine program. Things like where to get a dose and when you will be eligible for a second vaccine. But what's important to remember are a few basic points. All vaccines available are tested, safe, and highly protective against COVID-19. The vaccines as well are holding well against the current challenges created by the variants, including the Delta variant. Vaccines usually require more than one dose, so the 2-dose requirements for Moderna, Pfizer, or AstraZeneca are not unusual. What is important is completing your 2-dose vaccination. More than anything, right now, the best course of action is to get your 2 doses of vaccine and to take the vaccine available to you when you're eligible. The current sprint strategy has supported the provision of vaccines to 22 parts of the city where the risk of COVID infection is highest. Just about half have reached the vaccine coverage of 70%, meeting the provincial science table's benchmark for 1 dose or more in people aged 18 years or older. The focus on these areas will continue in earnest to improve these numbers and increase the level of protection in residents. Wherever we live, we all share the need to be fully vaccinated. The more people we have fully vaccinated, the harder it gets for variants like Delta to spread. The more people we have who are unvaccinated, the likelier it becomes that a new variant will develop, potentially with the ability to threaten the protection we've got against COVID-19 and all the progress we're making towards reopening. Right now, in Toronto, we have mostly mRNA vaccines made by Moderna and Pfizer. Pfizer is best known, probably because the manufacturer's name is familiar, and because for a long time, Pfizer was delivering a prominent amount of the vaccine we were using for vaccinations. Had the supply situation been reversed, Toronto Public Health, the hospital teams, and all the other vaccination partners would have happily and confidently used Moderna if it had been available in greater amounts earlier in the vaccination campaign. A colleague of mine at Toronto Public Health characterizes the two mRNA vaccines as twins. Earlier this week, the Globe and Mail described them like different kinds of bottled water. The name on the bottle might be different, but the contents are essentially the same. So in the end, you're getting the same thing, and that's the case with mRNA vaccines. Different names, different manufacturers, but built on the exact same foundation. mRNA vaccines are likely to become very familiar to us. Remember, the first successful vaccinations were against smallpox in the late 1790s. While new to use, mRNA vaccines have been in study and in development for 30 years. mRNA is to vaccination and to medical researchers what smartphones are to cell phones and to you and me. Researchers have taken something we're familiar with and made it better as a result of imagination, development, and careful, rigorous testing. Sooner or later, we're going to be mixing with one another much more than we have in a very long time. And this is great. It's what we have all waited for. It will not change the facts that we must accept. Despite everything, COVID-19 is still circulating and can still infect. COVID-19, especially the Delta variant, is still a force to be reckoned with. You want to avoid this, and you can. We are so fortunate in Toronto right now. We continue to receive supplies of mRNA vaccines and have a large number of places where you can get vaccinated. We also continue to see unprecedented demand, and many people want their vaccine as soon as possible. On the plus side, the wait between the first dose and second is reduced. As we approach the next phase on the province's roadmap to reopening, more mixing between people lies ahead. This means more opportunities for the virus to spread. Therefore, we can expect to see case counts rise. If you don't want to be one of them, please get vaccinated. There's never been a better time. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good morning. Before I provide my vaccine clinic operations update for today, I would like to acknowledge that yesterday we administered our highest ever number of doses of vaccine in a single day across our network of city-operated clinics. Yesterday alone, our city-operated clinics and mobile teams administered a total of 16,592 doses of vaccine, 15,057 doses in our clinics, and another 1,535 doses through our mobile clinic operations. This is an extraordinary achievement and one I'm deeply appreciative of. Thank you to everyone who has stepped up to make this happen, as well as everyone who continues to both administer and receive vaccine each day in Toronto. This week, across the 9 city-operated vaccine clinics, we are able to administer more than 111,000 doses of vaccine. Next week, we are able to administer more than 124,000 doses of vaccine. These are the highest vaccine clinic capacities we have achieved yet. We've been able to scale up to these maximum clinic operation levels as a result of additional supply of Moderna mRNA vaccine being provided by the province of Ontario. As of 10 o'clock last night, our city-operated clinics are nearly fully booked this week, with only 36 appointments remaining available. For next week, our clinics are 92% booked, with approximately 9,926 appointments remaining available. Given the reductions in the available quantities of the Pfizer mRNA vaccine, our clinics are administering the Moderna mRNA vaccine to everyone over the age of 18 years of age. The limited supply of Pfizer mRNA vaccine is being reserved in our clinics for those youth between the ages of 10 and 17 years of age. As Dr. de Villa has explained, the National Advisory Committee on Immunization has indicated that anyone who received a first dose of the Pfizer mRNA vaccine can safely and confidently receive a second dose of either the Pfizer or Moderna mRNA vaccine, and vice versa, resulting in them being fully immunized against COVID-19. We are continuing to work with the Province of Ontario with respect to confirming vaccine allocation for July 5th and onward. As soon as we have confirmation as to vaccine allocation for that time period, we will open additional appointments in city-operated clinics for the week of July 5th. Beginning July 5 and thereafter, each city-operated vaccine clinic will administer mRNA vaccines on an interchangeable basis, based on the availability and the supply of vaccine. Yesterday, more than 15,000 people were vaccinated against COVID-19 in our city-operated clinics with the Moderna mRNA vaccine. I, too, am one of the many people who have been vaccinated against COVID-19 with the Moderna mRNA vaccine. Our collective ability to remain ahead of the Delta variant and to keep the provincial reopening plan on track is largely dependent on our ability to get as many people fully vaccinated as possible, as quickly as possible. Everyone who is 12 years of age or older continues to be eligible to receive their first dose of COVID-19 vaccine. As of this morning, the Province of Ontario has again accelerated second dose eligibility. People who received their first dose of mRNA vaccine on or before May 30th and who live in Toronto and other defined areas are eligible to receive their second dose of vaccine, provided that it has been a minimum of 28 days since their first dose. Those who received their first dose of the AstraZeneca vaccine are eligible to receive a second dose at least 8 weeks following their first dose. All of the details on eligibility, along with the link to book your appointment online, can be found at toronto.ca/COVID-19. If you prefer to either book or reschedule your appointment by phone, you can do so by calling the provincial call centre at 1-833-943-3900. For vaccine opportunities outside the network of city-operated clinics, please go to vaccineto.ca for vaccine opportunities that may exist in our Team Toronto partner clinics. And for those active on social media, I continue to encourage you to follow Vaccine Hunters Canada on Twitter for additional information on opportunities to receive COVID-19 vaccine in Toronto. Please ensure that you cancel your appointment via the provincial booking system or the provincial call centre in the event you will not be attending your scheduled appointment. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on vaccine in Toronto. Thank you.
Thank you, Chief Pegg. We'll now go to questions. Just a reminder to please unmute yourself, and we'll go first to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Good morning, Brad. Good morning, everybody. First question's for the mayor. Since you chose not to mention it during your remarks today, I wanted to ask you about what unfolded yesterday at Trinity Bellwoods Park. Yesterday when I asked you about the optics of using armed police to clear out a homeless encampment, you told me that the police's role was to maintain peace. What we saw unfold yesterday was dozens of armed officers, including riot police armed with shotguns, pepper spray, and Arwins, along with corporate and private security, sealing up the encampment with fences and presenting a presence that almost make Doug Hatlam's portents about a war on the poor almost seem prophetic upon reflection. We also heard of a number of really concerning reports concerning police preventing journalists from covering the eviction and even the arrest of at least one journalist just for doing his job. All this prompted Canadian Association of Journalists President Brian Joly to condemn what happened and called it a complete overreaction. Even members of your own council were decrying what happened yesterday. And yet this morning on CP24, you described the police response as reasonable and compassionate. My first question is, how do you explain what happened yesterday, and what are the next steps in ensuring that journalists will be able to freely continue covering news in the city?
Well, thank you for the question. It's a number of questions there, Brian. But first of all, with respect to journalists, I believe it is very important that journalists should be freely able to cover events of this or any other kind that take place in the city. And I was not there to see the particular events transpire as it related to journalists, but I did see a lot of coverage of the event, both video and otherwise, photographic and newspaper coverage. With respect to particular incidents that might have occurred involving journalists, those are questions the police have to answer because it involves an encounter between the police and given a journalist or a journalist. I wasn't there, so I don't know, and it's proper for them to comment on that, as I'm sure they will do later today. With respect to the broader question of the involvement of the police, I think had it been the case that we were able to have our streets to homes workers and others safely both continue to speak to homeless people for whom we feel a complete obligation to try and help bring them inside to safer forms of housing, had it been for us being allowed to do that, and had it been the case that we could even have removed the empty tents from the site, and that there were no other people who showed up to try and obstruct that or prevent that from happening, then the police wouldn't have been called in. Again, I don't make decisions about where the police go, how many police show up, or how they conduct themselves when they're there. That's decisions that they make. But I do think that the response yesterday was in response to the circumstances that were created there when hundreds of people showed up who were not the people experiencing homelessness that we were trying to help, and involved themselves in the attempts the city was making to clean up these encampments in the context of both making sure the residents there, of which there were literally, I think, about 20, had safer housing, which we've been trying to achieve for months, 19,000, 20,000 visits to all the different encampments, and at the same time to also make sure the parks were available for the use of all citizens, and that those unsafe encampments were not continuing to be present there. And so I indicated yesterday, and I indicate today, I support the fact that that operation was undertaken with decisions being made by the people who undertook it, because I think the intent was something that was meant to help the homeless people and was meant to try and achieve it in a peaceful way. The fact that actually no one was injured, but that there was a huge police presence and a bit of a tumultuous scene was more a function of all the people who came out. And it was their right to do so, but that's really what led to the presence of the police there. Excuse me.
Okay, thank you. My second question is, in light of what happened yesterday, how does this affect the city's policy on encampments, and are other encampments scheduled to be cleared out in the near future?
Well, the bottom line is we've made no secret of the fact that we don't think these encampments are safe, we don't think they're healthy, and of course in the vast majority of cases they're not legal on public property. So that combination, plus our desire that we've had on a continuous basis, to the extent of 20,000 visits our Streets to Home staff have made to try and convince people to come inside, with some success, by the way. I mean, I think some 1,500 people have actually come inside as a result of these visits, that we will continue to do that work, but we will also continue to maintain the position, because I believe it is fundamentally the correct position, that you cannot have unsafe, unhealthy, illegal encampments in public parks in particular, but on other public property as well. And so we're going to continue to try to work with the people experiencing homelessness to convince them to take other housing options that are being offered and have been offered continuously throughout and that are still available today. And we will continue to do that and continue to try and urge that, for example, empty tents be taken away. We've been trying to have empty tents, of which there are many. There are far more tents and structures in these parks than there are people. And we've been trying to say, well, as a start, can we have the empty tents and structures taken away? And there's been a steadfast refusal, not on the part of the people experiencing homelessness, but people who are trying to, I'm not sure, make a statement from having those taken away so that we can make these places safer and so that we can reduce the footprint on the public park so that other people might be able to use those parks for some of the summer programs and so on. And we'll continue with that work, which we've been trying to do day after day after day, visit after visit, talk after talk. But there does come a time when you have to take some action on these things, and I just think we're there in the context of having spent months trying to do it a different way.
Thank you, Mayor Tory. We'll go next to Mark McAllister from City News. Good morning, Mark.
Good morning. Thank you very much. Mayor Tory, with regard to taking action, it was said that police were there to back up a city operation, and yet it seemed as though they were there from the start. The idea that fences were going to go up was probably premeditated and part of the operation as a whole. And it seemed as though it was the fences that, in fact, started what turned into a major confrontation. So again, is there another way to go about doing this without necessarily, because this is the second time in a couple of months that we've seen those confrontations take place, without bringing in the amount of police and security operation beyond just going in and talking to these people, which understandably you had done, but it seems almost too much yesterday and in the time prior to that at Lamport Stadium.
Thank you for that question. And again, I'll repeat something you alluded to in your own question, which is this. We have spent months as a city, 20,000 visits to these encampments to convince people to come inside and take safer housing inside. And as I've said, many people actually accepted that opportunity to the point where at a place like Trinity Bellwoods Park, I think as of yesterday morning, there were about 20 people left and way more structures than that. There's been a steadfast refusal in some cases with respect to those last 20 people to even allow the Streets to Homes team to continue to talk to them and to try to persuade them to come inside, and an absolute refusal to allow us to move any of those structures out of a public park, even the ones, especially the ones that were empty. Now, with respect to how security people were deployed and how many were deployed and so on, I can't speak to that. Those are not things that I participate in deciding upon. But I will say this, that the police were only even brought into the site. There were police that were there, and they were there for one simple reason, as were the fences there. And I didn't decide on or wasn't asked for my opinion on fences. But they were there to protect the safety of the city workers, both parks and recreation workers, and Streets to Home workers who were there to speak to the remaining people experiencing homelessness and to try to convince them yet again to come inside and to protect their safety against what we had been warned were people who would come out and try and create a direct physical interaction between those people. And I will tell you this, and I tell you this in all honesty, this is part of what I have to deal with in my job in terms of the staff who work for our city. We've had staff in there in all of these different encampments for weeks now who have had weapons pulled on them. They have been followed home after work. They have been abused. They are doing their job, trying to persuade people who have a lot of issues in their lives to come inside and get help from the city in housing better than in a public park. And those people who are doing their jobs for all of us in the city deserve to be protected, as do the people experiencing homelessness. And when you have large crowds of people showing up who are, frankly, unconnected to the interaction between the city and those people experiencing homelessness, there have to be certain measures undertaken to keep everybody safe, including the people who show up to protest, because it is their right to protest. And so the police and other people, security officials and city officials, made decisions with respect to what steps should be taken to keep everybody safe. And I would point out that while there was a bit of a scene of some chaos, I'll call it, that you could see on television, there were, to my knowledge, no serious injuries. I don't think there were any injuries at all. And I am sure that in the aftermath of this incident or this series of events yesterday, there will be a full review of how you could do anything like this better if there was to be a next time. I'm just sure of that. In fact, I would ask that that be done, and I'm sure it's being done without my asking.
Thank you for that. Much of the call yesterday was about permanent affordable housing. understanding that that is a major operation and it is taking place in the city, specifically, how many modular home units that have been created, temporary hotel rooms are vacant at this time, and what specific accommodations were offered to those staying at Trinity Bellwoods yesterday?
I am very glad that you asked that question, and I deserve to be criticized that I don't have the exact number here with me because it does fluctuate from day to day, but I will tell you this because I've asked about it every single day that we've been talking about the encampments, and that is that I have been assured every single day, without exception, no day on which there was not adequate numbers of hotel rooms in particular, but also places in other forms of housing, including shelters, but not dominated by shelters, to accommodate every single one of the people that could have been moved out of the, say, the park like Trinity Bellwoods. I mean, yesterday at Trinity Bellwoods, we were talking about 20 people. And I can assure you we had way more, because I know the number is in 3 figures, like it's hundreds of opportunities to have people move into hotel rooms. In some cases, we even took some of the people we were trying to persuade to move inside to the place they would be taken, like a hotel, and gave them a tour so they could see where they would be taken. I mean, people should think about this for a minute. When we were offering probably the majority of these people a place in a hotel room, this is not somewhere where they're going to be in some danger compared to being in a place in a tent where there are propane tanks and where there have been numerous fires and where there are health hazards. And the hotel rooms had supports associated with them provided by the city to help people with some of the issues they face in their lives, which I'm very well informed of. And so I would just say that there was never a problem, and those who were spreading the word that there was inadequate numbers of places to take, frankly, almost all of the people residing in all of the encampments, let alone just Trinity Bellwoods, are spreading information that is false. And I would not, it wasn't up to me as to when security and encampment clearing operations were undertaken, but I can tell you this, I certainly would have spoken up in dissent about anything being done if I thought there wasn't a place for every single one of those people that we have gone to speak to day after day after day and who were spoken to again yesterday. 12 of them actually did accept going to various places they were taken for housing that was better than a tent in an encampment in a park.
Thank you. We'll go next to John Chidley-Hill from the Canadian Press. John?
Good morning, everyone. Mayor Tory, I'm going to stick with you on the issue of the encampments. Deploying the private security forces and the police and the fences and all the other equipment yesterday, I assume would be an expensive event for the city. I'm curious, are you concerned about that expenditure of money? And also, if so, do you think that money could have been better spent proactively rather than reactively, whether it's more counseling, more streets to homes workers, more food, other services that could help people experiencing homelessness?
Well, I think you can always do more, but I will say in response to that question that we as a city are doing more than ever has been done before on counseling, on streets to home activity. I mean, you don't have 20,000 visits made to people in encampments trying to persuade them to come indoors to safer housing, without the people to do that who have to be paid for. And we've had help from the other governments in undertaking some of these efforts to the extent they've been affected by the pandemic. And I will say the same thing with respect to the rapid provision of additional supportive housing in particular. Thanks to the help of the other governments, in particular the rapid housing program of the federal government, we have literally purchased buildings that are being converted as we speak, and so they'll be available within weeks and months, not years, in the hundreds, to accommodate people who are in need of supports in their lives. And I would just say to you that as part of a transition we are making to exactly what I hear people talking about, which is instead of relying on a constant expansion of the shelter system, which we were urged to do repeatedly over the years by the very same people, we are moving to a model that says, no, it is much better to provide a home for people, permanent housing. I've toured as recently as last weekend one of the modular housing developments that has gone up in a matter of months and is now housing people who might otherwise end up in encampments, but certainly people who are experiencing homelessness. They're getting the supports, they have a home, they're happy with that. We're doing more than any government if you go back decades. I'm not sure if you go back and you'd find any government doing more than we are doing at this time in this city to create that kind of housing, and we're making great progress in the hundreds of units. We're making progress in the hundreds of units more than the total number of people that are presently residing in encampments in public parks. And my point is very simple. We will provide safe, and we do provide, and we have provided safe indoor housing for hundreds and hundreds of people we have moved out of encampments. But for those who remain there, we need to do the same thing. But we need to have the cooperation of people who will at least not obstruct us from talking to those people and making every effort to persuade them to come inside. And we can't indefinitely just allow unsafe, unhealthy, illegal encampments to remain in public parks indefinitely. And that is the position that has been taken by the city very publicly and transparently. But our overriding sense of compassion for the people and wanting to help them remains our top priority and will remain our top priority going forward. We were back at it this morning, trying to visit with the people who are living in encampments, trying to persuade them to accept the housing we do have available, which includes supportive housing, it includes hotel rooms, and yes, it includes a shelter system where a huge effort has been made to make sure that it is safe, to the point where, as of this moment and for all of this week, there have been no outbreaks of COVID-19 present in those shelters.
As a follow-up, I know COVID-19 has sort of sparked this growth of encampments across the city, but there's other factors at play as well. Mayor Tory, I'm curious, from your perspective, what have been some of the other factors that have led to the growth of encampments across the city? And do you think that this is a symptom of a larger housing crisis in the city of Toronto?
Well, I've been the first to acknowledge on many occasions, and it's been part of the pitch that I've made successfully to the other governments to help us, and I will say that especially the federal government has responded with programs that are helping us immeasurably to create hundreds of new supportive housing units, and both governments have signed together on a national housing strategy that in Ontario and in Toronto is allowing for the present approval and construction of thousands of affordable housing units. Again, a pace of the development of affordable housing which is still not good enough, but is way in excess of what has been done by previous administrations going back all the way. So we are presently engaged in doing just that, which is the major thing. If you ask me what is contributing to it beyond COVID-19 itself, I would say to you, and I've said this again many times publicly, this will not be the first time I've said it, the inaction, the relative inaction on mental health is a huge factor in my view. So instead of having proper treatment and assessment facilities and proper attention that should be paid as part of a health problem that people experience, health with their brain as opposed to health with any other part of their body, some of those people end up dislocated because of their mental illness. I think that that poverty as something that is particularly affecting marginalized communities has contributed to a crisis that existed prior to COVID-19. I think the situation with drugs, which again I've spoken about quite openly, again has contributed to this, in that you're creating people who are particularly marginalized because of a health problem that they have. And so I have spoken and we have acted on all of these things. Could we do more? Yes. Would I rather have seen the money spent instead of on a large operation involving police and many other staff people? Yes, I would. Did we have an obligation as a city when we were going to try and clear those encampments, and most importantly to try and persuade the last 20 people to take housing indoors? Did I have an obligation? Did the whole city administration have an obligation to make sure that those homeless people and that the staff who were talking to them remained safe in the presence of hundreds of people there to protest? Yes, we did. And so in that case, I don't know what the totals are of the expenses. I didn't make the decisions on how people were deployed, but I do think that people would have been very critical of us if any of the people experiencing homelessness or city staff had been injured in the course of carrying out the discussions that had to happen yesterday with them about rehousing them, and so the operation unfolded as it did.
Thank you. We'll go next to Linda Ward from CBC News. Linda?
Hi there. The allegations from those experiencing homelessness that I spoke with yesterday at the encampments are that they don't want to go to shelters and hotels because they say they've experienced assault and abuse in these places. They don't feel safe, especially during a pandemic. And studies have shown recently that during the course of the pandemic, people using opioids are increasingly overdosing while alone and dying alone in these hotels. What is the city doing about investigating these claims and solving this problem?
Well, the experience in the hotels has been such that we have added supports to the hotels over the course of the pandemic to make sure that people who had mental illness issues in their lives, people who had substance issues, had the supports available in those hotels to make sure that they could be given counseling and assistance so they were not alone and so that they had help to turn to. And so that has been done. I know that for a fact, and I've talked to the people who have been providing some of those supports when I've had occasion to visit. And so I would just say that, you know, obviously the whole opioid situation across the city is in and of itself a crisis, and I have spoken on that and have indicated a willingness to look at other options that we can undertake beyond our existing harm reduction efforts to help those people and to try to address this problem, because others try to turn it into some kind of a moral issue or even a legal issue, which really it isn't. It's a health issue, and we have to help people who have terrible challenges in their lives. But I would say to you that the efforts that have been undertaken with respect to safety in the shelters, in the hotels, have been, I think, substantial on the part of the city, and I think they've been successful in the context of making those places as safe as possible to go from a health and safety perspective. And I would say as well that we've made other forms of housing available, including some of the supportive housing and including, for example, units that happen to be vacant in Toronto community housing for the benefit of those who are experiencing homelessness. So I think the city has done a great deal in this regard, and I think you have to remember that we did it concurrent with the fact that during the pandemic we had to literally move thousands of people out of the shelter system and into alternate accommodations in order to preserve social and physical distancing to stop the spread of COVID-19. And so none of this is perfect by any means, and I don't pretend that it is, but I think the city has made extraordinary efforts, accompanied by extraordinary, compassionate, competent, professional efforts on the part of our city staff to make sure that we looked after the most vulnerable people in the most complete way you possibly could.
Thank you. And I just want to ask about this accelerated rollout, more people becoming eligible today for the vaccine. Is there any way that we can measure the effect that this has had on the spread of the Delta variant in Toronto compared to if we had stuck with the original vaccine schedule?
So, Linda, that's an interesting question, and I think it's one that we will continue to reflect on and try to understand better. Certainly, it is easier to determine what we might have expected in terms of vaccine coverage or vaccination coverage under the original schedule versus that which we're getting as a result of the accelerated schedule. But I think, you know, perhaps what might be done is looking at models of what we anticipated would have happened under Delta spread in the two different scenarios. I don't know that we'll be able to be extremely definitive, but I think that's a very interesting question that you raise and one that I'll take back to the team for sure.
Right, thank you. We'll go next to David Ryder from the Toronto Star. Dave, go ahead.
Hi there. First question for Mayor Tory. Mayor Tory, you keep saying that you don't direct police or the city bylaw or the enforcement, but my question is, I guess maybe shouldn't you and council get involved? Because if you say to police, do whatever you can to sort of protect the area, we get what we got yesterday, which looks like the G20. You get people penned, you get journalists not able to do their job, and you get a massive show of force for dealing with a situation that involves, as you've said, dislocation and mental health and suffering. So is it enough? Because at the end of the day, those images go across the world and you're the mayor. Shouldn't you and other decision makers be involved and come up with a better way?
Well, I did say that there should be a review undertaken of what transpired yesterday with a view to trying to find a better way. You can always find a better way. I think the principle is well established that politicians do not direct the police. And I think that that is well established and well accepted that politicians should not direct the police. There is a police board that sets policies with respect to what the police does. There are politicians on that board, but they don't constitute the majority. You know, if this matter comes up at the police board, then I will be there together with the other two members of City Council and the other members of the police board to address those issues. But let's go back to the basics here. There would have been no need whatsoever, and the police were not deployed. They were off-site, as it were. They were not deployed in any significant way until hundreds of people, unconnected to the dialogue that was trying to be conducted between the Streets to Homes city staff and the Parks and Recreation staff and the people experiencing homelessness, was complicated by the presence of hundreds of people, some of whom, if you look at the very same television pictures, were creating a situation of some concern in terms of the physical safety of the people experiencing homelessness and the city staff. And so that's why the police were there. Now, again, you can take up with the police how many people were there and how they dealt with that instability that happened on that site at that time. But let's be clear, it was neither the city staff or anybody associated with the city, nor was it the people experiencing homelessness who created the need for police to be there. And I think that had there been serious injuries or worse to either city staff or people experiencing homelessness as a result of this event, which was not the case, the television pictures and other things people saw around the world or even just here in this city could have been far worse. And so I didn't direct how all that unfolded, and I'm not being critical indirectly by saying I didn't direct it. I don't direct those things. People accept the fact that the mayor shouldn't direct those things. Of course, I will be involved in at least reviewing what people come up with in terms of looking at how it unfolded yesterday and how we could do it better. But I think part of doing it better would involve people who have a perfectly legitimate right to protest. If they want to protest, stay back and protest in a way that doesn't interfere with legitimate operations that were going on to remedy both trespasses, but more importantly to try and help the people who are living in that park to find other housing and to have those discussions with them.
So the follow-up is, I think you're saying that you're sure this is going to be reviewed, but we've got lots of other encampments across the city, and you're also saying action is going to be taken. So are the same tactics, the same approach going to be used in the other, are we going to see what we saw yesterday repeated over and over with the possibility of injuries? Because when you have a massive show of force, as we saw with the G20, it doesn't completely eliminate, and in some cases, some people would say accelerates the chance of somebody getting injured.
I would say to you that the tactics that will be repeated will be the tactics we've employed out of compassion for the people who are experiencing homelessness, and that is that we have continued as early as this morning our visits as best we can make them, because in many cases we're obstructed from talking directly to the people who are experiencing homelessness, and certainly obstructed from taking things like empty tents and structures out of those parks. But we will continue to try to persuade whoever we have to persuade to come into safer housing. We will continue to try and persuade those who are stopping us from removing empty structures from the parks, because that would be a step forward in the context of the health and safety of everybody involved and the use of those parks, the preservation of use of those parks for all members of the public. With respect to how future operations to try and diminish these encampments are concerned, I'm sure that those who undertake those operations will be having discussions about how it can be done better. The objective here is certainly not in any case whatsoever at any time to create any physical encounters or altercations, or to even have, this comparison that people keep making to other events that happen in history are far different. As I said, we started yesterday in a park that had 20 people experiencing homelessness in, I think, about 60 or 70 structures that were in the park. So those were the two things we had to deal with. First and foremost, trying to find housing and persuade the people to accept housing, permanent indoor housing for the people who are experiencing homelessness, and secondly, to have those encampments taken out of the parks where they are not safe, they are not legal, and they're not healthy. And so it doesn't take a lot of police officers unless there's intervening forces that happen to accomplish that. And if people wanted to let us go quietly about the business that we're legally and morally and otherwise obligated to undertake as a city, then I don't think there'd be any police necessary at these things whatsoever. And if people want to let that work unfold, then I guess we could do things quite differently, we meaning the city in the broadest sense. But you'll have to take up the particular practices to be used in trying to remove encampments and safely rehouse people with those who directed those operations yesterday, which did not include me.
All right, thank you. We'll go now to Miriam Edahaya from Radio Canada. Miriam, go ahead, please.
Hi, Mayor Tory. Hello, everyone. My question is about the reopening. Mayor, what can you tell us about what you know thus far? Will there be a reopening earlier than expected in Toronto, such as personal care services? You talked about it a little bit yesterday. What are you hearing from the province?
Well, notwithstanding that I have basically daily conversations with the Premier about many matters, including this. I don't know much more than what you know. I do know what I saw the Medical Officer of Health for the Province of Ontario saying yesterday, which is that he thought that some of the progress we were making might allow for a couple of days of leeway with respect to reopening. Beyond that, I will simply repeat what I have said, and I think it's consistent with what others are saying, which is I would like to see that reopening safely occur as soon as possible. I also do think that there's a plan that is in place that was set out by the province. I think it was widely commended by people as being a sensible, clear, consistent plan, and that that plan should be the guide. The ultimate decision, as you know, rests with the province. The mayors that I'm a part of and chairs that met on Monday of this week said they were encouraged to hear some of the discussion of possibly seeing, for example, personal services businesses open a day or two earlier, some earlier time. And I was part of that statement, saying I was encouraged by that too. And that if the health and science numbers and other kinds of analysis that have to be done allow for that, then I'm sure that's what the province will do. So, you know, my position is as soon as possible that it can safely be done, but that we should be continuing to exercise, you know, caution only because the variant situation and COVID-19 itself have not just gone away. They're still around. They're still around in some places not too far away from Toronto and even in Toronto itself. Dr. de Villa can speak better to that, and that I just think we have to be careful so that the worst thing of all, I think, the worst thing of all, which would be some backsliding into some other kind of shutdown later in the summer, is avoided at all costs. And I think most people, the vast majority of people, would agree with that. Whatever you do, do it in such a way that we do not have to legitimately have any fear of a further lockdown going on because we reopened too early sometime later this year.
Thank you. And I'm wondering if Dr. Eileen de Villa can speak to that as well, if reopening earlier would be safe.
You know, I think the mayor covered off all the key points, you know, in respect of the answer to this question. You know, there's no denying, and I did comment in my remarks, that we have come an incredibly long way in a short period of time. And this is really due to the efforts of all of us across the city. We've seen people participate in self-protection measures, the measures we've spoken about for months now. And importantly, they are taking advantage of the protective benefit of vaccines, which are increasingly available throughout the city. And furthermore, with accelerated second doses, we have that opportunity to get that fulsome protection that's provided by vaccines. The science available out there tells us that this is the best thing that we can do, that we do need 2 doses on board to be as protected as we can be. We're watching the experiences around the world very, very carefully. We've seen what's happened in the United Kingdom, both with Alpha, the variant that was formerly called B.1.1.7. We have watched their experience, had a very similar experience to them. They're a little ahead of us in respect of Delta. They have seen some increased activity with Delta, despite high vaccination rates. They accelerated their second dose vaccination campaign. We're doing the same thing here in order to get that fulsome benefit. So no question, we all want to get back to the activities that we've been missing for many, many months now. We want to do so safely. I think the mayor has expressed the desire to see reopening, yes, in a manner that is safe and that allows us to you know, ensure that we reduce any likelihood of significant surges of COVID-19. The best thing we can do with that is to get more vaccine on board as quickly as possible, to continue to be vigilant around self-protection measures, and hopefully we will be there sooner rather than later to where we all want to be, which is the other side of this pandemic.
Right, thank you. We'll go next to Hannah Alberga from CTV News. Hannah, go ahead, please.
Everyone, good morning. My question's for Mayor Tory or Dr. de Villa. We've been hearing more anecdotes about people showing up to get their second dose appointments only to walk away once they've been offered Moderna. Has the city implemented at this point any kind of standby list that they can call people on in order to limit vaccine wastage?
So, Chief? Yeah, do you want to take that one? You're probably better to.
Sure. Hi, Hannah. Chief Pegg here. Good morning. We have not implemented a standby list at this point, and I'll explain why for a couple of reasons. Number one, as you know, throughout our response to COVID and certainly immunization operations, we are clients of the provincial booking system. And that means that that functionality, the functionality that exists within those constructs is what we rely on. But I think more importantly, the manner in which we have managed vaccine, which has worked and continues to work impeccably well, resulting, I'll say, in doses not being wasted. Any unused vaccine, any doses that are not used in a particular day are maintained in allocation and are carried forward into the subsequent day and potentially into subsequent weeks. And that is one of the reasons why we have a number of times been able to rather what appears spontaneously, but rather frequently open additional appointments. So none of those doses are wasted. Our vaccine management strategy and vaccine management practices are very robust and are designed, and I candidly believe are effective in making sure that as very many people as possible are able to book their appointments as quickly as possible. I will also say, just for your information, that yesterday, for example, we were in a clinic yesterday, and I had the chance to meet with not only staff there, but also talk to Commander Bionzik and our clinic management team a number of times yesterday. We are seeing very low, as of yesterday, very low numbers of people who are declining their vaccine. They are arriving. You heard in my remarks, we had more than 15,000 people receive Moderna mRNA vaccines in our clinics yesterday, which is fantastic. We're at the highest levels of dose administration we've ever been at. That will continue not only this week, but it'll continue next week and in fact increase again. So I really appreciate, I know there's been a lot of change. We certainly recognize that. I appreciate everyone's understanding and patience as we have pivoted and transitioned off and moved in response to changing vaccine allocations. And I know that our residents have come with us on that journey. And as a result, we're seeing thousands and thousands of people being vaccinated every day, and I'm certainly appreciative of that.
So would this issue be something that we're just hearing anecdotally? It's not necessarily something that needs to really take steps to deal with?
It's something, Hannah, that we're monitoring very closely. We literally monitor this on a day-to-day basis. There's a couple of data sources for that. So it takes our team, oftentimes there's about a day delay or so to get a really good picture on what happened the day before. And that is because we're drawing data from two sources. We know the number of appointments that are being booked in the provincial booking system up front, and then all of the actual doses administered are being entered into the provincial COVAX On system. So we need to pull that data out of those two sources. There's some analysis that needs to happen. Our good colleagues at Toronto Public Health are monitoring very closely things like no-show rates. Those are the number of appointments where people have confirmed appointments and for whatever reason fail to arrive for their appointments, as well as anyone who is arriving at a clinic and subsequently declining to participate in or declining to receive their vaccine, I should say. So the information I have from our teams that were on the ground yesterday is no significant issues yesterday at all. The staff were happy, the clients were happy, the level of service across the network of clinics was fantastic, with more than 16,000 people being vaccinated. So in my estimation, great news all the way around.
We're going to go back to Miriam Medahaya from Radio Canada. She had a follow-up, which I failed to recognize, so my apologies. Miriam, go ahead, please.
Thank you. My question is for Mayor Tory about the announcement this afternoon. What can residents of Scarborough expect?
I think they can expect, after decades of waiting, that there's going to be the first steps taken to actually get construction underway this year on the extension to the Bloor-Danforth subway line into Scarborough. And this is going to, at last, after many years of debates and commitments and various other things, provide a connection to jobs and opportunities for the people of Scarborough who have had historic underinvestment in transit, and which we're now remedying with this subway extension and with Smart Track, which is proceeding with a new station in Scarborough. And I ultimately hope with the Scarborough-Eglinton East LRT, which will also serve many neighbourhoods and will turn around completely the underinvestment in Scarborough Transit. So we're looking forward to actually taking the first steps and having people see that this is a project that is real and that it's going to be built and that it's going to be available to serve them not too long from now.
All right, thank you. Our final question is to Natalie Johnson from CTV News. Natalie, go ahead, please.
Hi, everyone. A vaccine question for Chief Pegg. Now that you're able to start maximizing your city clinic capacity, do you have a sense as to whether you can meet the demand of the latest surge of people who are eligible to book second doses as of today? The group that got their first shots up to including May 30th, or is that number still so large that there will still be challenges for people booking appointments at this point?
Hi, Natalie. Good morning. First and foremost, I will say that all of us, but I certainly continue to be nothing less than excited to see the uptake and the interest in people both booking new first dose appointments and people who are both booking their second dose and then taking advantage of the opportunity to accelerate those doses. That's fantastic news. We are working literally every day with the province of Ontario with respect to vaccine allocation. Dr. de Villa may wish to add to this, but what we're waiting for right now is additional clarity, or I will say clarity in general, with respect to supply chain confirmation and vaccine availability moving forward, and that's out into the July 5th and later. We have opened every single appointment for which we have vaccine allocation for, and do I think that we have enough appointments available between now and the 5th of July to meet that demand? No, frankly, I don't. We are waiting for additional vaccine allocation. I'm confident that that will come. And I should say, by way of an aside, the 9 city-operated vaccine clinics, of course, throughout the pandemic have been the backbone, if you will, of the immunization clinic operations, but are but one part of that total Team Toronto effort. There are numerous clinics happening every single day, and I should just add my thanks and my excitement, really, for what is coming on Sunday through the Scotiabank Clinic. And the fact that we are, for the first time, in a position where there is vaccine available in order to run that type of clinic, and that we have the fantastic Team Toronto partners that we have, and people like Maple Leaf Sports Entertainment who have come together to do everything that we can do to provide this big push for vaccine is exciting. I look forward to seeing that in person and to doing my part to say thank you to everyone that's going to make that possible. Dr. de Villa may wish to add to the vaccine.
Yeah, I think the only piece that I would add perhaps is that of course we are pleased to see that there is continued demand for first dose and second doses and continued demand for appointments to receive these vaccines. We are, of course, awaiting confirmation of supply. This is something that we are in constant conversation with our provincial partners with, or about, I guess I should say, as the chief says. And as soon as we have that confirmation, we'll look forward to being able to meet that demand for vaccination appointments, and we'll open up new appointments. It all depends on making sure that we've got confirmed supply. That's all.
And recognizing that you're still waiting on confirmation for the supply for July 5th and onward, given that you're maximizing capacity for at least some weeks and potentially moving to that model moving forward, has any more consideration been given to a 24/7 clinic model?
Natalie, something we're continuing to watch very closely. As we talked about earlier, and you may have heard in my remarks, this week and next week, we've actually been able to increase the clinic capacities now to the highest levels ever. That is a testament to our ability and to the plans that have been in place and pre-existing since the commencement of immunization task force operations that let us scale those clinics. So we are scaling up. The transition there has been throughout the response and throughout the vaccination operations, off and on some discussion about extended hours and 24-hour clinic operations. There have been those types of operations. There's been extended clinics operated by some of our Team Toronto partners. What continues to evolve, and I would say the most recent example we're seeing is this Sunday at the Scotiabank Arena with the single big push that will happen that day. Really continuing to drive and continuing to make as many appointments available as we can make on the day well advertised as far in advance as possible, and giving people the opportunity via the provincial booking system and other booking systems to get confirmation to book and to have the flexibility and freedom to choose the appointment location and date that best suits them. That to me seems to be the best, simply the best answer. It's producing great results. But having said that, as always, we're watching this very closely. Dr. de Villa's team on the vaccine distribution task force is directly connected with the team that I'm responsible for with respect to immunization task force, and this continues to come down to the availability of vaccine. If and when we continue to see significantly enhanced doses of vaccine being available to us, we are absolutely ready to expand clinic operations across the city to meet that demand.
Thank you, Chief. Thank you all for joining us. That concludes today's briefing. Please have a good rest of your day. Thank you.